The COVID-19 pandemic has brought about many changes, some of which may have contributed to an increase in anxiety disorders. According to World Health Organization, anxiety affects 264 million people worldwide. That's a lot of people walking around with their heads in the clouds, unable to focus on anything else but their fears.
People who've had COVID-19 are more likely to develop depression or anxiety.
And according to a study published by the British Medical Journal on Thursday, COVID-19 patients saw a 35% increase in risk for anxiety disorders and 39% for depression.
No need to stress. Therapies like exposure therapy can help with anxiety and other disorders such as PTSD, social anxiety disorder, obsessive-compulsive disorder, and phobias. Exposure therapy is a type of mental health treatment that helps patients confront their fears and anxiety triggers in a safe, controlled environment. There are 4 main potential benefits of exposure therapy. Emotional processing. To overcome a phobia, exposure treatment is repeatedly facing that fear. Extinction. Unlearn negative associations with a feared object through exposure therapy. Another is habituation, exposure to frightening stimuli repeatedly over time, and self-efficacy, which demonstrates that you can conquer your fear and regulate your anxiety. The strategies employed by a therapist during exposure therapy are condition-specific. What you could encounter: first, after determining the cause, your therapist or psychologist will expose you to fearful stimuli. Second, they often generally begin with a minimally frightened stimulus or mimicking your trigger. Your therapist will gradually expose you to increasingly frightening stimuli. And last, your progress determines the number of sessions and length of therapy.
The clinical evidence for that is overwhelming. We know that if you expose people to the things they're afraid of, but that they're avoiding, they get better. And you have to do it carefully and cautiously and with their own participation and all of that. But of all the things that clinicians have established that's credible, that's number one.
I don't believe him. There's just got to be more to it.
Indeed. There are 4 different types of exposure therapies that we'll touch basis on. Vivo exposure. It entails confronting your fear in real life. Imaginal exposure is where you imagine what you fear vividly. Virtual reality exposure, when it is difficult to feel a source of anxiety, in reality, virtual reality technology may be employed. And last but not least, interoceptive exposure. In order to prove its safety, even if it is feared, this form of exposure causes a bodily experience. Start your search from reliable sources such as American Psychological Association. You can also consult the National Association or network that specializes in your disease, such as the National Center for PTSD. Thank you for watching my video on exposure therapy. I hope you found it informative and helpful. If you liked what you saw, please like and subscribe to my channel.